What I actually like to do, Dr. McElhaney, is start off with a question for you.
Yeah.
Other than the flu vaccine, which sounds very important, what are other measures that people can take to help prevent them from getting the flu? Are there any other recommendations that you would make to them?
Yeah, so a few things are, the usual precautions that we tell people is to, stay home when they've got symptoms so they're less likely to be spreading them to you. I actually suggest that particularly where you've got a lot of contact with families and you feel that you're a high-risk individual, that you encourage your families to go out and get vaccinated as well so they have less of a chance of spreading that to you. Keep distancing is really helpful, so that if you notice that somebody's coughing in the grocery store, is the example I used, those droplets from flu only go about 3 feet or so. So if you keep your distance out about 6 feet from people who are coughing, you're less likely to pick that up. And of course, hand washing, because that's what it gets on surfaces, and you touch things and then put it in your eyes and your mouth and that sort of thing, and that's how you contract the flu. So distancing, hand washing are the two most important things to do, and it doesn't require any fancy masks or gloves or anything like that.
Okay, thank you. That actually sort of speaks to one of the other questions that was asked, which is, if germs are airborne, why are we told to wash our hands? And I think you've sort of addressed some of that, because indeed there is transmission, not only airborne, but also through contact.
It goes on the surfaces, you pick them up, it lives there for a while.
Dr. Cook, there's a question for you here with regards to what causes death after hip injuries. So after hip fracture, what are the major causes of death?
That's a good question. I think much of the causes of death after hip fracture, again, relate to that slide that Dr. McElhaney put up, where there is a functional decline that happens that can lead into quite a spiral of other adverse health effects. So I think you'll, maybe not necessarily in this case, but Dr. McElhaney and I have also spoken before, and there is also the risk of infection as well when you are more run down, impaired, or susceptible. So it's not any specific cause of death, and it's not necessarily right after the hip fracture or right in hospital either. It's a trajectory that can happen over a larger period of time.
Okay. I actually have a couple of questions here that have inquired about some of the controversies around the potential dangers with regards to the vaccination for the H1N1, the pandemic vaccine. Can you comment about some of the results of that? Or also as well, a variation of that is some of the results of the clinical tests are not really out yet. Are we ready to recommend these vaccinations at this point?
So what the reference is to the studies that have been done, there was some suggestion from a study that was done in Canada that people who developed H1N1, if they had been vaccinated, there was a higher risk. They had gotten seasonal vaccination last year, that in the spring those folks were at higher risk of contracting H1N1. So I can tell you that those studies were, we've got quite conflicting results, and in other countries they've shown exactly the opposite result. And so every time you're looking at these kinds of studies that aren't really what we call well-controlled, in other words, we just have to kind of take all comers, and we don't really know the reason why that association happened, but it all comes down to kind of the fancy statistics, and when you see one study showing one thing and another study showing something different, there's probably not much to it. Okay, so I think that's sort of off the table. In terms of testing these vaccines, there has been a lot of experience with this, the particular type of this adjuvanted vaccine that we're using in Canada for pandemic influenza. Been lots of testing in Europe and all over the place. So yes, we are ready to use these vaccines. They are safe. The issue that has not been tested, at least to my satisfaction, is that whenever you look at these studies, always go and look to see how many older people over the age of 65 they actually had in these studies. And usually it's not very many. So we can't draw any conclusions from that. I don't have an issue with the safety of the pandemic vaccine. But what we haven't tested is whether or not giving both of these vaccines together is completely, that there's no interaction between the two. And so I answer this question. I don't want to go against what the public health officials are recommending, but for my mother, my suggestion is that she just get seasonal flu vaccine. So I hope that
just before we ask a question of Dr. Cook, I think this relates to what you just answered, Dr. McElhaney. I think this is a question where saying if the regular seasonal flu shot is being withheld, and I'm assuming that's for the people under the age of 65 or not in a high-risk group, would you recommend having both, I guess? And is that sort of also your opinion outside of the older adult population?
Yeah, so for younger people, the reason why we're giving them the pandemic flu vaccine now, and if we've got seasonal, we'll give both together, but we need to get the pandemic vaccine into them as soon as possible, because this is right now. And this will be over by December. We'll be saying, okay, what now? Because this pandemic will have gone through. So we want to give them the vaccine while they're at risk of contracting it. The seasonal vaccine in younger people can wait until, it could wait in older people until we're closer to the flu season, but there's no reason to wait in older people, and particularly if you can get some benefit from that seasonal vaccine that'll protect you from both pandemic and the seasonal strains that are going to come later this year, then that's why we're saying make sure you get your seasonal flu vaccine, but in younger people, it's just that we're trying to get the pandemic one into them soon enough that they can actually get protection against what's circulating.
Okay. Dr. Cook, I have two questions, and this is with regards to, I think, sleep aids, sedatives, and falls risk. So I'm going to ask you sort of two questions. First of all, would you consider melatonin as a sedative, and if such, is this a falls risk? And the other part of it is that if then, in talking about your sedative tapering program, can you just explain or expand upon that a little bit more?
Sure. Two great questions. So although melatonin can at least have an effect on your sleep-wake cycles, I would not consider it to be sedating medication outside of the time that you're wanting to be asleep. I don't believe it has other effects on your attention and alertness. And I have not come across any research studies looking at fall risk and melatonin. So within the limits of that, I'm usually supportive of patients who do wish to try melatonin. So I should probably qualify that earlier comment, but definitely don't consider it to be a sedative in the way that other medications that are used because of their side effects of sedation to promote sleep. So the other question was the sedative tapering program. So what we're doing in the fall clinic here, I've got the luxury of working with an occupational therapist who's got some great skill at reviewing and promoting sleep hygiene, and also working with our patients really over a long-term basis for relaxation techniques and other aspects to be able to diffuse energy. Because a lot of times people are using sedatives for sleep, but the issues as to why they can't sleep can be many and varied. Sometimes it's related to pain. Other times, and we've all experienced this, you may be just lying awake and your mind is going a million miles an hour and it's really hard to wind down and go to sleep. So we've certainly encountered this in a lot of our patients, and she's used a whole bunch of different, very creative approaches. I can think of a person I saw today. She started actually journaling and getting some thoughts and comments down on paper, which was a really surprising approach for me. The other thing she started using was a relaxation CD, and that seemed to be the trick for her. And it's been it's probably been months, I think, but I work in conjunction with our occupational therapist to actually gradually taper the sedative, because everybody's usually taking that medication for a reason. And I've finally at least developed the humility to get off my soapbox and at least recognize that you need to be able to replace something for sleep, or whatever the reason was for taking the medication, to be able to help the person have a good night's sleep and not miss the sedative that is being tapered. And we found that to be a very effective way. Some people are able to just stop them immediately. Others feel very worried about decreasing their medication at all or tapering, and we found this can really help over a gradual period of time where the person themselves can feel in control of when they decide to decrease.
Dr. McElhaney, I have two questions here that sort of deal with bad reactions to the flu shot, and I'm just going to explain. One person mentions that they had a bad reaction 2 years ago, and as such, their doctor is recommending against not taking the flu shot. And in another case, a person has got the flu shot every year for the past 4, yet developed some severe cold or flu-like symptoms anyway, lasting 6 to 8 weeks, ending up on antibiotics. What sort of advice would you give these individuals?
So the people who've had a severe reaction to a flu vaccine, it's often because they're allergic to the preservative in the vaccine, and for those people, they will have a problem with the vaccines. And so there are now available preservative-free vaccines, or at least really low levels of those preservatives. So that's something that one can try. But when that happens, we have to pay attention to that if it's really an allergic reaction. The other scenario, that's really uncommon. The other scenario that you've mentioned is very common. And just to make 2 points, you cannot get the flu from the flu vaccine. It has killed virus in it. Remember I said that it's got to be able to just start replicating inside the lungs to cause problems. So you cannot get it. And the reason why people feel like they've gotten the flu from the flu vaccine is because we have all kinds of viruses that circulate during the fall that are not flu. And you can just get one of those and it's typically a virus called parainfluenza. And it has nothing to do with influenza, and it's not prevented by the flu vaccine. It makes you feel crappy. It happens in the fall, and it goes on for weeks like that. But people confuse that as a side effect of the vaccine, and they would have gotten it anyway, whether or not they were vaccinated. It's the other problem we're going to run into as we start vaccinating people when we've already got flu in the community, because people are going to think if they got flu right after they got vaccinated, they're going to think they got it from the vaccine, when the risk is out there is exposure to everybody out there that's in the public right now. That's where they're getting the flu from, not from the vaccine.
Okay, thank you. Dr. Cook, I have a question here about vitamin D deficiency. How would one know if you were deficient in vitamin D?
That's a good question. The symptoms of vitamin D deficiency can very often go unrecognized, but the symptoms can, when they're very severe, lead to pain in the bones, which can arise from rickets. But when it's milder, or we see it in older adults, sometimes it can actually manifest as muscle weakness as well. It has been described, even in older adults, just the vitamin D deficiency can lead to decreased mineralization of bone, and there can sometimes be even a little bit of bone swelling with variation in water content that can lead to discomfort. So it's another interesting and probably unrecognized cause of back discomfort as well. I think the most straightforward way to find out if you have vitamin D deficiency is actually to get tested, or simply go ahead and get supplements. Really, it's very difficult because these symptoms are so nonspecific, and I have been routinely testing in the Falls Clinic, and it's been quite remarkable how many people I have picked up with vitamin D deficiency who would not have been symptomatic and we would not have otherwise known.
It's hard to also overdose. You can't overdose on the vitamin D, so you've got nothing to lose.
There was a recent review which looked at well-conducted vitamin D studies, and they were looking at the required dose, and I alluded to that earlier. But one of the other things they did was they actually looked at the form of vitamin D being used. Most of us will take what's called a 25-hydroxy form, and then once in our body, it actually gets converted to an active form by our kidneys. But it's also possible to take this active form, so we don't need our kidneys to convert it. And in the studies that used that formulation, there was a slightly greater chance of having a high calcium level. And what they found was that at equivalent doses, the usual form of vitamin D that's available on the pharmacy shelf or the grocery store shelf was adequate to reduce fall risk and achieve the vitamin D levels that you would want.
And it also strengthens your immune system. So,
all good reasons. I have a question here, Dr. McElhaney, and the first question is, when do you think the flu shots will be available? Can you comment on that, like seasonal flu shots?
Seasonal flu shots are available right now. We've had many. I think that there will be more shipments of them. I think they used up most of the doses that have already been shipped, but there's more to come. And there's so just look to your where you're usually getting your vaccines at the community centers or wherever. But there will be more vaccines coming. It has been delivered already. It's the pandemic vaccine that we've been waiting for that was just announced as being released today.
Another part of that question is in terms of individuals have heard of course, the live vaccine versus the attenuated virus.
Yeah.
Is there any recommendations you can make in terms of which one? Because they're already receiving advice in terms of saying, well, maybe don't get the live one, get the attenuated one, etc.
Yeah. So this is the nasal vaccine. It's a live attenuated virus. It doesn't add anything to the protection you get from the regular injected vaccine. So it's not recommended in older people at all. So that's off the table in terms of whether or not you need to get that vaccine. It doesn't add anything to what you get from just the regular vaccine.
Dr. Cook, here's a question for you. Is it better for individuals to use a cane or a walking pole in terms of stability?
Good question. It really depends on why you need to use a walking aid in the first place. Often, if a person has relatively well-preserved balance and they are able to still ambulate reasonably well, often it's just a cane that is needed for a small amount of added stability. A cane can also be useful if you have a painful side to be able to provide an extra base of support where you put the cane out when you put, say, your sore leg forward to walk. We usually think of walkers when a person needs additional stability and support for walking. When balance is further decreased or compromised, or if there's a need for support on more than one side. You can sometimes use canes in two hands, but that does take a bit of coordination.
Okay. I think if I read these two questions and comments correctly, there's a few individuals who are wondering, they're generally healthy otherwise, one person in their early 60s, another person following more of the, recommendations and guidance of a naturopathic physician or naturopathic remedies. From their point of view, they've never had the flu shot. And they're wondering, what advice would you give to them in terms of getting the flu shot? And I think the first question is referring to seasonal flu, or should they get the pandemic flu vaccine when it becomes available?
Somebody in their early 60s, that's a tough question. That's right on the borderline for the age groups for which we're recommending this pandemic vaccine. And the risk really changes around about age 65 or 70. So if you're really, whoever this is, if you're really a healthy, young 60-year-old, you're probably, if you're going to get one vaccine, you probably want to get the pandemic vaccine. But if you feel like your risk is more related to seasonal influenza, then I would get that one. But you can get both as well, and you're covering your bases. But if I had to choose one based on that scenario, I'd probably go for the pandemic vaccine. And what am I doing this year? I'm going to get both because I have to not only protect myself, I have to protect all those patients I'm exposed to. So whether I'm going to give it to a young person or an older person, that's not for me to decide. Protect against both.
We actually have about 4 more questions, and I think we do have time if everyone's willing to bear with us to go through them, because I think they're all excellent questions. And then maybe after that, when we're finished with the questions here, we can move outside for more one-on-one time. The question that I have for you, Dr. Cook, and actually a lot of people are wondering, how do you access the Falls Clinic?
I'm glad you asked. So patients access the Falls Clinic often, well, through a few routes, but probably the most practical or feasible one would actually be through your family physician. We also get referrals when patients come into the emergency department and are seen for a fall and are also lucky enough to be seen by a geriatric emergency room nurse. But any physician can refer. We have also taken referrals from other healthcare workers in the community, because often occupational therapists doing a home visit may identify a need, or a physical therapist may have identified a need as well. And usually we will double check with the family physician to make sure that they are on board and supportive as well.
Dr. McElhaney, I have a question for you, and this is it is related, there's no doubt. But one of the questions, very importantly, asks about the pneumonia shot. So this individual had the pneumonia shot about 7 years ago and has now been asked to take it once again. Can you comment on why that recommendation has been made?
Yeah, and so this is really important, and most doctors don't know this yet. So there was some evidence that we should be repeating these vaccines in older individuals. So the indication was once at age 65 and then repeating that vaccination every 6 to 7 years after that. But what we know now is that these particular vaccines, and it's again the way that they're formulated that may be the problem, but we've now found that those vaccines are not effective when given a second time, and they may actually suppress the response. So we're going back to saying that it's once at age 65 and not to repeat it. We are looking for improved vaccines against this, against pneumococcus, but we can't stimulate the immune system the same way by giving a second dose of that vaccine. So that's really new stuff. These guys might not even know this.
You're right.
So I wouldn't be surprised if doctors, but you can just let them know, and if they have any questions, please tell them to contact me. We're trying to get that message out there.
So a very important question, no doubt. Dr. Cook, we have a question here about the use of sedatives. I guess it's the whole idea that comparing, say, stopping cold turkey with tapering or lower the dose, is it, if you can't necessarily stop completely, is lower better in terms of dose?
I think less is very likely better, because you would assume that there is at least less of it circulating in your system. And I would still consider that at least to be some success towards your goal. We don't have very good information from studies of sedatives looking at specific doses. Usually the studies have involved patients being on or not on. So I can't give you a very well-researched answer to that, but I'm always encouraging my patients at least to aim for some progress. And even if you can feel confident that you've achieved some level of decrease, you may feel ready to decrease it again at some point in the future. So consider yourself on a journey with a final goal in mind.
Okay. And a couple of last questions. Dr. McElhaney, can you comment on Tamiflu? Is this useful for both seasonal flu as well as the H1N1 virus?
Yep.
Okay.
I just will add
Please.
to that these drugs, these antiviral drugs, are much more effective in older people who've been vaccinated than the ones that haven't. And it's the way that they work. So get vaccinated. And then if you need these other drugs, you have a much better chance of getting a response to them.
And the last question that I actually have is asking for a comment about last year's vaccination. I think there was a lot of general, information in the media and such that the effectiveness of the vaccination program last year was less than what was anticipated. Can you comment on that and maybe speculate as to why it may have missed its mark?
Yeah, it didn't. And so remember I showed you that virus particle with everything going on in the little tip of that thing? This is even when we don't get the right strain in the vaccine, we still get protection, okay? And a lot of my research has been focused on saying that for older people, we can't just talk about protection based on antibody titers, which is what we typically use. There's all kinds of evidence that those vaccines, even if they don't quite hit the mark, are still very protective in older people. So that is simply not the case, but it's the media tends to sensationalize this, and we do see, in young people, when we get a mismatch where they're more dependent on these antibodies, we may see a bit more illness, but we are not going to see the serious illness going up because we've just missed the mark a little bit on the vaccine. So get them every year. It doesn't matter whether we, quote, missed the mark.
Well, I want to take this opportunity to thank both of our panelists, Dr. McElhaney and Dr. Cook, for hopefully what you found to be a wonderful and interesting and engaging set of presentations this evening. As we mentioned, we will be moving outside into the foyer shortly, but perhaps you can join me in a round of applause for both of our presenters.
And Dr. Lee, thank you very much. You've been a wonderful moderator.
I do apologize.